So good afternoon, everyone, and welcome to our Let's Chat Immunizations workshop brought to you by Univera Healthcare. I want to start out by thanking each of you for taking the time out of your day to join us here today for our Understanding Your Wellbeing webinar series that we launched in 2025 for our Univera members. If you've attended one of these webinars in the past, you may be familiar with the fact that I am Katie Keller-Burgess, and I am part of the Wellbeing team here at Univera Healthcare. So I will be serving as the host for today's webinar, teeing up our guest speaker, Dr. Deanna McDonald, who will be presenting the majority of the content for today's webinar. So just a few housekeeping items to start us off with here today. Please note that today's webinar and all of our 2025 Wellbeing webinars are being recorded and are being housed on our Univera Healthcare YouTube page. So my colleague Kate is actually just putting in the chat now the link to that page. So once again, if you need to go back and listen to maybe this webinar or access a previous month webinar that you're interested in learning more about, you have on-demand access to those monthly webinars right on our YouTube page. So definitely check it out. Another housekeeping item I do want to call out is that all participants' microphones and videos are automatically disabled. Now, there will be time at the end for any questions with Dr. McDonald. So we are encouraging all participants to ask any questions that you may have in the Q&A feature within the Teams webinar. So at the top of your Teams, you should see that Q&A icon. So once again, at any point throughout today's webinar, if you do have a question, please feel free to ask that in the Q&A and we will address it at the end. And then the last housekeeping item that I want to call out, it is important to note that the content covered here today is meant to be simply educational in purpose. So of course, if you have any specific health-related question or concern, we do recommend that you connect with your primary care provider. Or if you have any specific benefit, question-related concern, we recommend you call the customer care number that is located on the back of your Univera Healthcare member ID card. So with that being said, I have the distinct pleasure of introducing our guest speaker here today, Dr. Deanna McDonald. She is a board-certified medical director supporting our safety net population. Now, Dr. McDonald holds a bachelor's degree from Nazareth College, as well as a medical degree from the University of Buffalo Jacobs School of Medicine. Following medical school, she completed her pediatric residency at Women and Children's Hospital of Buffalo, now known as Oishei Children's Hospital, which also included an additional year as chief resident. Now, Dr. McDonald has cared for thousands of children throughout her practice. She has been awarded Best Practice, Best in Class, which is really recognizing her efforts in clinical excellence and the delivery of quality and efficient care. She joined the medical director staff here at Univera Healthcare in the fall of 2022 and currently resides in Western New York with her husband, 3 children, and her miniature golden doodle. When in her spare time, she enjoys traveling, watching her children compete in sporting events, relax on the boat in Lake Erie, and of course, chill on our hometown team, the Buffalo Bills, in the fall and winter. So Dr. McDonald, once again, thank you for taking your time here today. We appreciate it, and I will turn the stage over to you.
Thank you so much. I am thrilled to be here today. I'm thrilled to have this opportunity and to share with all of you a topic I'm so passionate about, especially as a pediatrician who practiced in the community of Buffalo for about 15 years. So today we're just going to go through some, basic information about vaccines, touch on the diseases that they prevent, and the current vaccination schedules. I do want to also discuss some myths, if you will, or concerns that are out there about vaccines, really common questions that I would get asked a lot in practice, and then where you can go for trusted information. And then the team is going to conclude it with discussing additional benefits and resources offered by Univera. And so vaccines. This is truly one of the most remarkable scientific achievement of our time. It's one of the greatest health success stories. It's one of the best preventative health tools that we have. Vaccines were developed to reduce disease, to reduce death from that disease, to prevent spread of disease, to control spread, and really to allow people of all ages, from infancy to adulthood into the elderly, to have longer, healthier lives. Over the past 50 years, vaccines have been responsible for saving at least 154 million lives, which is just pretty remarkable for any medical tool that we have. All the diseases that vaccines are developed for, they all carry substantial risk for serious illnesses and even death. That is why we have developed vaccines for these certain diseases. We want to keep our children, our families, our community safe. And when you get vaccinated, your family gets vaccinated, your child gets vaccinated, you're not only protecting your family members, but you're also avoiding spreading preventable diseases to others in the community. Vaccines are recommended by every scientific authority in the United States. They're recommended by doctors of all different specialties, pediatricians, family practice, OBGYN, nursing associations, internists, or adult doctors. They're recommended by state and city health departments and children's hospitals nationwide. And so in order to understand how important vaccines are, it's important to know what life was like before they were here. And in that time, before vaccines, there was universal infection, meaning most people got infected with a lot of the diseases that we now have vaccines to prevent. There were outbreaks, there were epidemics. An outbreak is something when a disease is occurring more than what is expected. And the response to an outbreak from the medical community, from hospitals, it can be both costly, not just financially, but also with a lot of lives. An epidemic is even worse. It's when an outbreak gets to the point that it can't be slowed, it can't be stopped. The disease is spreading too rapidly to too many people within a community and region. And the picture here kind of demonstrates what the reality was before vaccines. This is a hospital ward. The cylinder pieces of equipment you see there, something called an iron lung. This was used to help keep people with polio alive, and this was commonplace in hospital wards across the country. It was common that you got measles, you got pertussis during childhood. Most everyone got that, but that also meant thousands of children were hospitalized, thousands of children suffered serious consequences, something called encephalitis, which is inflammation of the brain, and even died. Diphtheria, smallpox, other outbreaks common, and then as we talked about, polio. And so, to understand about vaccines, I think it's important to know how they work, but it's also important to understand what happens when you do come across a germ. So, if you're exposed to a germ from a virus or from a bacteria, and it enters into your body, what happens is your immune system becomes activated. And there's various layers to that and various steps to that, but your immune system's job is to say, hey, something foreign has entered my body, and now I need to attack it and get rid of it. That is a process that does not happen instantaneously. And it takes some time in your body to recognize the germ, to make a response to it, to attack it, to get rid of it, and then to create antibodies that remember that germ. And so why that's happening, and while the virus or the bacteria is in your body at a large amount, it's replicating and it causes symptoms. It causes you to get sick during that process. And then eventually your body, for the most part, can take care of it, remember it, and develop an antibody response. Now, when you are getting sick from it, some people can have minor things, fever, cough, but others can have pneumonia. They can develop seizures. They can become blind. They can have brain infections. They can die. And so there's no way to gauge what's going to happen to each individual. The best thing about vaccines is they work the same way with our immune system, just as the real infection does, except it's a small, inactivated or weak form of the virus or the bacteria that gets administered. The immune system sees that as foreign, recognizes it, and develops those same protective antibodies. You get the same immune response for a smaller amount of that germ, and then you remember it. So if you do see the virus or the bacteria in real life again, and you're exposed to it, your body remembers, sees it, recognizes, takes care of it, works fast because it doesn't have to go through the whole process initially. Another very important concept of immunity and vaccines is a concept called herd immunity or community immunity. And so when you're getting vaccinated, you're not just protecting yourself, you're really protecting your community. And this picture, I think, really drives that message home. If you look at it as three separate columns, if you look at the first column, all the blue individuals, they represent those who have not been immunized, but they're still healthy. The red individuals are those who have been, who are sick and who are contagious, and they're intermixing with the non-immunized healthy individuals. And what happens is most of those individuals get sick and become contagious themselves. If you move to the middle column, you can see that there are a couple individuals who are immunized now, mixed in with the healthy non-immunized ones, and you have the two who are sick. And again, most of this group is getting sick and contagious and spreading the vaccines or spreading the virus, excuse me. In the final column here, most of the population is vaccinated. And so when the two sick people interact with that population, as you can see, the 4 who aren't immunized and are healthy, 3 still are. And so majority of the population is protected. And so there are some people who cannot get vaccines because they either have had a severe allergic reaction or their immune systems aren't as strong. And so they do rely on this herd immunity to protect them. This is a list of all the vaccine preventable diseases, the diseases that we have vaccines to protect against. Not all of these are on the recommended schedule. Some of these are more applicable to international travel, but these are all the vaccines that have gone through trials and are marketed and out there and available for people to obtain. But sadly, we still see vaccine preventable diseases even today. And a lot of these reasons, they are interrelated to each other. There are decreased vaccination rates, and that's for a variety of reasons. Some people choose not to get vaccinated. Some people lose protection to vaccines that they already had and don't know that they need a booster for that. Some people don't have access to health care. The COVID pandemic, people were isolated in their homes. Vaccines were delayed for them because they couldn't get into their doctor. And then really the most, I think, important thing is we do not live in isolated world. The United States is not in a bubble. We live in a global community. And I found this fact astounding is that over a course of a year, 37 million people are arriving to the United States from around the world. They're coming from places that may not have vaccines there. They may not have access to them. They may be coming from places where diseases that we don't have here are prevalent there. And they're bringing it to our country. And so, unfortunately, that's why we are seeing vaccine preventable diseases still in this day and age. But the truth is that vaccines work. They're effective. They do the job that they set out to do. They're reducing disease and they're reducing death from those diseases. This table was pulled from data that was collected back in 2019. It's diseases that we have vaccines against. Most of these are given on the recommended schedule. That's recommended to babies, children, adolescents, adults. And you can see in the last column that all these diseases decreased by almost 100%. Most of them did. And so truly vaccines are doing what they're supposed to do to help keep our people safe and our communities safe. So vaccines are important, but just as important is following that recommended schedule for vaccines. It is very important that we give vaccines at the right time. And so the schedule is there because that is what has been scientifically reviewed, studied, tested, gone through safety trials, that we are giving the right protection at the right time. Vaccines that are given together, they're given together because that's how they were studied together and they were found to be safe and effective. When the schedule is not followed and there is a delay, it really leaves, even for especially in infancy and childhood, those babies and those kids vulnerable to a disease. And so, we really try to always follow that schedule because it is the right protection at the right time. And here I just have for your reference, if you want to look back on, this is the current recommended immunization schedule. The next few slides, it's broken down by age range. This is from birth to the age of 6 years old, usually when kids are entering kindergarten. The next one here is from kids 7 years of age through 18 years of age. And then finally here, the recommended immunizations for adults. And I'm just going to pause here for a second because I think, and I'm probably biased too because I'm a pediatrician. We tend to focus a lot of our vaccine information surrounded around kids, but adults need vaccines too. And in fact, 1 in 5 adults are found to be not up to date on vaccines, which leaves many of our adults vulnerable to disease. And we want our adults to stay healthy, just like we want our babies and our children to stay healthy. And adults also have a lot of underlying health conditions, which actually puts them at greater risk if they come into contact with a vaccine preventable illness. And so by making sure our young adults, our pregnant adults, our elderly adults are vaccinated, we're helping them to stay healthy. We're helping to prevent severe illness spreading to others. We're reducing their risk for hospitalization and serious consequences. So now shifting gears a little bit, I'm going to kind of talk about some questions, concerns, myths, if you will, that come up about vaccines. And the one thing that people are always concerned about is that they are not safe. And this couldn't be farther from the truth. And so, what does safe mean, really? To be safe means you're not in danger. Unfortunately, there's dangers in everything we do, and an inherent risk really in everything we do. People every year are killed by other things. 500 people every year are killed from choking because they choked on a piece of food. 50 people are killed every year in the United States because they're struck by lightning. 350 people are killed every year because they had an accident in a bath or shower. But none of us would say we're never going to shower again. We're never going to go outside again on a rainy day. We're never going to eat food. Because obviously the benefits of being outdoors, eating, doing everyday normal activities far outweighs the risk. And the benefits of vaccines far outweigh any risk. The harm that can come from a disease and the risk in that is far more severe than the common risk that you may encounter with a vaccine. Commonly, most vaccines, they might cause a little bit of pain or soreness where the vaccine is injected. There might be a little redness there, a little bit of tenderness or swelling at the site, might have a low-grade fever. But having a serious adverse event is extremely, extremely rare. It's 1 event per million doses. And vaccines are one of the most well-studied pieces of medical tools that we have. They go through a rigorous safety protocol before they actually even come to the doctor's office to be administered to patients. The United States has a long-standing safety system. It's the safest supply in history and in the world is vaccines found in the United States. Before it even gets to being tested on humans, there's studies that are run in labs on the vaccines. Then goes into clinical trials. And at each stage of vaccine development, vaccine safety, vaccine trials, vaccine monitoring, the clinicians are looking at, is the vaccine safe? Is it doing what it's supposed to do? How is the body reacting to it? And the standards of that vaccines have to undergo is such a high standard. This is a wonderful graphic. It's the vaccine life cycle, but it really shows that at every phase, safety is the top priority. And so the beginning part of the life cycle is when it's going through development and not even being tested yet. It's before any testing is happening and before it's even going to clinical trials, already looking to see if it's safe. Various phases in clinical trials, safety is tested right along the way. Then it gets reviewed, and then it goes to another committee to review. All of physicians, researchers, people who have been studying vaccines for their entire professional life. And then even after vaccines are put out into the doctor's offices to be used to prevent diseases, the safety monitoring is still ongoing. And there's a variety of systems in place to continue to monitor safety. It does kind of reach all parts of the healthcare model. The VAERS system, really that can be reported by anybody who receives a vaccine. So any individual, any clinician or doctor, nurse, doesn't matter who reports. Couple of the other measures to report safety concerns or questions about vaccine safety can come from clinicians who are studying it, even through doctors if they have a question about a possible reaction in a vaccine from a vaccine in patients. There's different outlets for people, doctors, clinicians to report or ask questions about safety. Even health plans have a way to look at health claims to monitor for safety issues with vaccines. So another common belief is that, hey, natural infection is better than the vaccine. I'm sure some of you have heard of people having chickenpox parties. I know there were people who were having COVID parties, thinking, all right, this kid has it. Let's get a bunch of the kids sick all at once so we can get over it. Everyone's had it. Everyone's protective. But there is a huge gamble with doing that because, yes, natural infection gives you immunity to a disease, just like immunization does, but the price that you're paying for the immunity is high. And so if you look at the column on the left compared to the column on the right, it's the natural infection versus immunization, respectively. And so you are taking a gamble with a large amount of a certain virus or a certain bacteria when you are doing the natural infection. And so when you're giving something in a larger amount, you're going to have more symptoms. And you cannot predict who's going to have severe symptoms and who's not going to have severe symptoms. There's no way to know if, for instance, your child is the one who's just going to get maybe a fever and a rash with chickenpox and be itchy and miserable for a week, or is your child the one who's going to develop pneumonia, end up in the hospital with a breathing tube, or even worse? Also, some, outside of obviously these parties, you wouldn't know when you're going to be exposed. With a vaccine, you know when the exposure is being given. It's in a small amount based on scientific evidence that this is the right age for it to give the best protection. And so really vaccines are taking the luck out of building an immune response to a certain virus or to a certain bacteria. So the next concern is has to deal with babies and infants. And, if you remember on the previous slide, we did look at the schedule, and a common question I would get asked in practice is, this is way too many vaccines to give my little baby. They're too small. They can't handle it. It's way too much for them. And this really couldn't be farther from the truth. The first thing is, we do live in a non-sterile world. The minute a baby is born, they are entering that non-sterile world. They are in contact the minute they are birthed with bacteria, with viruses, with foreign objects that challenge their immune system. Every single day, a baby's immune system is challenged by 2,000 to 6,000 antigens, or what we were talking about before, germs, every single day. A vaccine only has 150 antigen components. And so what that really boils down to is when your baby has their first runny nose and cough, that is activating their immune system far more than a vaccine. And babies, they're incredibly strong. Their immune systems are incredibly remarkable. They have actually enough antibodies to respond to 10,000 vaccines at one given time. And so really, if all 14 of the scheduled vaccines were given at one time, it's still only using 0.1%, minuscule amount of the baby's immune capacity. And so pretty impressive what our babies can do, and their bodies and their immune systems can handle these vaccines and can give them the protection that they need to stay healthy. Another concern that parents often have is that, what are these vaccines filled with? Are these chemicals safe? Are they toxic? And I think it helps to just know what is put into vaccines. Vaccines only contain ingredients that are needed for them to be safe and to be effective. It's a very simple recipe, and the ingredients in there are not harmful to individuals. And so this kind of breaks down really the main components of the vaccines. You have your main ingredient, or the active ingredient, which is the antigen, or which is the inactivated or weakened virus or bacteria. You have something called adjuvants, which typically is aluminum, which is found in our environment, but the amount of aluminum in these vaccines is very minimal. It's actually less than is in breast milk and less than in a food that an infant will take in their diet. There's antibiotics in there in a small amount, and that's really to prevent bacteria from contaminating the actual vaccine. There's something called stabilizers, and that helps keep the vaccine effective. And that can either be sugar or gelatin. Finally, there's something called preservatives, and then other trace components. The major preservative that individuals are concerned with is something called thimerosal. And actually, thimerosal was removed from all childhood vaccines back in 2001, which was it was more than 20 years ago. Thimerosal is not really found in many vaccines. The only one that still may contain small amounts of it is the multi-dose flu vaccine. But even for adults, they can get vaccine formulations that do not contain thimerosal. Another concern is, do vaccines cause autism? And this concern arose back when an article was written and put in a scientific journal back in 1998. So really almost 30 years ago. It was written by a gastroenterologist, or a GI stomach doctor, who looked at 12 children, and he thought there was a connection between them getting the measles vaccine and autism. This ended up being disproven, and since that time, multiple studies that were better designed, that were contained many more children were conducted and repeated over and over again. And so taking all these studies in total, it's looked at over 1.2 million children. And the conclusion has been consistent with all of these studies, and that vaccinated children develop autism at the same rates as unvaccinated children. That original article that was published was actually retracted or pulled from the literature. It was disproven, and the doctor lost his license. And so I think, okay, fine, the studies didn't show it, but then why do you feel like everyone's getting diagnosed with autism? And another reason for that is 30 years ago, autism was a tough diagnosis to make. It required seeing a specialist. It required needing to meet strict criteria that you needed to have like 8 positive responses out of 16 questions. Today, you only need 2 positive results to get a diagnosis of autism. We also didn't screen for it. Screening for autism is routine now in pediatric practices. If you have children, I'm sure you've completed screening questionnaires for autism. They can be given at 1 year of age. Most are done at 18 months, 2 years, 3 years of age. And a pediatrician, family medicine doctor can make that diagnosis. You don't need to make an appointment with a specialist to get a diagnosis of autism. And so just our recognition of it has increased over the last 30 years, and that is why the diagnosis has increased. And it's important that we recognize it and screen for it, because what we have found, kids who are diagnosed early respond really well to early intervention and do really well. And so it is important to screen for autism, but there is no link between vaccines and autism. All right. So where can you go for more information? You know, everyone wants to go to the internet, of course. And, you know, there's certain little tricks that might give you more reliable information. And so looking for .gov at the end of websites, .edu. You really want to be careful with .com, .org websites, and especially social media. Misinformation has a way to spread very quickly on social media, and you have to be so careful with it. There's really no filter for accuracy on social media. How things get sent to you is based on algorithms, based on you clicking or looking at one thing once, and you just get inundated and flooded. There was actually a study who looked at vaccine misinformation and anti-vaccine content done in 2021. And it found that 65% of all social media anti-vaccine content originated from only 12 people. So it just shows how fast misinformation can spread. But it can be confusing, and that is fine. And so really, you know, I think, yes, you can go, and I encourage you to go and look up information, but really your doctor is your best source. If you have questions, if you're not sure what you read is true, or is there some other place I can follow this up on, ask your doctor. That is what they're there for. You know, we all went into medicine to prevent disease. We really don't want to treat disease. We want to prevent disease from occurring. And so your doctor is there to help you and help you and your family make good decisions that help you have healthy lives. I put some other sources there for your reference as well, where you can get some good vaccine information. And so wrapping up here, you know, I really truly hope that you can walk away today feeling that you learned a little something that maybe you didn't know. Maybe it prompted a question that you do want to ask your doctor at the next visit. I really hope I drove home that vaccines are safe, they're effective, they're meant to protect everyone from infancy to late adulthood, from disease, from being hospitalized, from having long-term disabilities and death. I mean, it's truly one of our greatest medical achievements, and I always get emotional at this part, but you know, yes, I'm a pediatrician, yes, I'm a doctor, but my most important job is a mom. And my three children, 15, 17, and 19, I always would tell my patients, I would never tell you to do something for your children that you feel that I feel like I wouldn't do for my own children. And so, my children have been vaccinated. They're all wonderful young adults. And I hope you learned something today. Thank you. All right, I'm going to turn it back over.
Dr. McDonald, that was amazing. Thank you so much for the overview, the details. As you mentioned, I hope everyone here was able to take away at least something. I know myself, I continuously learn things whenever attending these webinars. So just thank you again for your thoughts, your considerations from, your practice perspective as well as a fellow mom. So as mentioned, if you do have any questions relative to any of the content that Dr. McDonald just covered, please feel free to enter them into the Q&A as we get through some benefits and resources here. And then once again, we'll dive into any of those questions that have come through. So with that being said, we are going to move along into just a few tools, resources that are available through Univera Healthcare for our members to be able to access. So as Dr. McDonald mentioned, really that first layer of defense and who you can go to talk about immunizations is your primary care provider. So a big question that I often get out when in the market, attending different things is, well, how do I know what doctors are part of my plan or who is accepting, things along those lines? So I did want to highlight the Find a Doctor tool that is available on our Univera Healthcare website, so members can log in, and we encourage you to do so because once you are actually logged in, your results are going to be personalized to your plan as well as any possibility of spending or deductible if applicable. But essentially within this Find a Doctor tool, you're able to search for various doctors, specialists, urgent cares, even hospitals. Once again, within our local as well as potentially national networks, depending on where you may need care. And then based on the search results, you're able to filter to different things, such as maybe that potential specialty, the languages spoken at the office, if they are accepting new patients, and more. And then you're even able to see a side-by-side comparison of providers to really make a fit that is the best for you and or your family. And a part of that tool, there is also an estimated cost tool. So once again, if you are somebody potentially on a high deductible health plan and paying for services up front, once again, that cost tool can really help for you as a member to better estimate what cost could be potentially incurred. So once again, we encourage to log in for the estimated out-of-pocket cost specific to your plan relative to year-to-year spending or deductibles. And then you're able to research medical costs across more than 1,600 different treatment categories, as well as 400 procedures. And once again, filter based on cost, treatment provided, location, and more. So some great tools we just like to highlight there for our members to be aware of in case you are looking for care. And then the other benefit that I wanted to mention here is our care management team that is available through Univera Healthcare. And that team of healthcare professionals, such as registered nurses, registered dietitians, respiratory therapists, and more, are really all right here for you whenever you need us. So this team is here once again, maybe from little health questions to big health challenges. They're here to support our members of all ages at no added cost. So you can see some of the different concerns and or conditions they can help to provide support, guidance on, whether that be mental or behavioral health concerns around anxiety, substance use, depression, maybe chronic conditions such as diabetes, high blood pressure, cholesterol, maternal health, weight loss, smoking cessation. Once again, this team is here for our members to be able to support you if you have questions, maybe around appointments, medications, a lot of great things. So highlighting this team, and one way to connect with this team is the free WellFrame app that Univera members can download. So once you download it, you'll be prompted, to create your WellFrame account. Once again, free to do so. You'll need your name as well as your subscriber ID from your health insurance card. And then the access code to use when registering is Univera Welcome, all one word, all lowercase. So another great benefit and tool to check out if interested in connecting with that team for additional support in your back pocket, if you will. So with that being said, I want to thank you all for once again taking the time to join us here during the lunch hour. I did want to give a quick plug for our next month well-being webinar, and that is support for mental health and substance use disorders. So September is National Suicide Awareness Month, so really highlighting and bringing to awareness the topic of mental health specific to substance use disorders. So Dr. Stacy Elliott, another medical director here at the health plan, as well as a board certified psychiatrist and addiction medicine physician, will be covering information on the intersection of mental health and addiction, understanding substance use disorders, recognizing the signs and symptoms, treatment options and resources, and more. So once again, there is the QR code here on the screen, and then my colleague Kate in the chat will place the direct registration link, once again, if interested in signing up for that one. So with that being said, moving right along into the questions, if any have come through. So moving into the Q&A, I don't see any questions as of yet. So once again, last plug for anyone on the call, if any questions relative to what Dr. McDonald covered here today, feel free to enter them there and we will get to them. But Dr. McDonald, I know you mentioned being a mother and like myself, had a unique kind of question. I know it wasn't covered here, but hand, foot, and mouth. I recently dealt with this as a parent here. So how come things like that can't have immunizations? Can you talk through that at all for me?
Yeah, I wish there was an immunization for that. It's actually, I think, worse for the adults who get it from their children, to be honest. And so the vaccines that target that the diseases that are targeted by vaccines are really the ones that are found to have the most serious consequences. And so yes, hand, foot, and mouth is miserable, but it's not the same as, if you want to talk about virus with a fever and a rash, it's not the same as measles or chickenpox, because kids who can get chickenpox and measles, they can actually have worsening problems in other systems of their body. They can get pneumonias, they can get meningitis, they can get something called encephalitis. And so really the vaccine development is a target against the viruses that cause the most harm, or bacteria that cause the most harm. So, hand, foot, and mouth is bad. But an enterovirus, there's also different types of enterovirus and different types of enterovirus families. And so it's a very broad virus too. So that's why sometimes kids get it maybe more
multiple
than once.
times.
Yeah.
Knock on
Yeah.
wood, hopefully not in
Yeah.
my situation there, but thank you. Just more information for myself personally. Another question that came through is, it still important to vaccinate against diseases such as polio if essentially they are eradicated? What are your thoughts there?
Well, yes, because they actually are making a comeback, which, if you remember, we talked about the reemergence of vaccine preventable illnesses. And so when people are like, oh, well, we haven't seen polio in like 20 years, but sadly, there have been outbreaks. New York City has had outbreaks because fortunately, some communities choose not to vaccinate, which then puts other people at risk, and then the spread just continues. And so the only way to minimize spread and a vaccine preventable disease that was almost eradicated from coming back is to continue to keep up on the vaccinations. And so
Great call out. And then the last question here, just based on time as well, what are some of the barriers you typically see regarding vaccine access, maybe in underserved communities? Do you have any thoughts there?
Yeah, I mean, we definitely, a lot of the barrier is people, transportation is a huge barrier. There are vaccine programs for people who do not have insurance and can get vaccines, but maybe they can't get to that clinic, or they can't get to the health center or the community center or the county department to actually get the vaccine. Understanding too is a big barrier. Maybe they haven't been to see their doctor in a while and are like getting all their information from the internet or from social media, and that's another reason why, or a barrier to not getting vaccines. And so, I think the great thing about our health plan in Univera is we have such a robust network of people who want to help those who want to stay healthy, and we have a lot of people in place who can help give people information on how they can get vaccines and help get them there in terms of transportation if that's a barrier. And so there's ways around that, and our health plan does a wonderful job of giving people those resources. So
Awesome. And yes, that care management team, if anyone is looking for resources, is a great kind of liaison there. So
yeah.
great info to finish us out with here today. So once again, thank you, Dr. McDonald, for your expertise, information that was covered. Thank you again to everyone for attending here today. We hope to see you at next month's webinar, and enjoy the rest of your summer.
Thank you very much for your attention.
Bye, everyone. Thank you.